Bob and Brad, the two most famous physical therapists on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we are joined by a super guest, and his name is Jeff Comey. He's an instructor at a physical therapy assistant program.
Right.
And he used to do coordinating for the sites too, right?
All the internship setups.
Internships,
now.
yeah.
Right.
So,
And you've been at this for 24 years at the educational level?
That's right.
That's right. And he's good on the floor working with patients. And you still do some patient
I still
care.
do patient care. That's the heart of it all right there.
Right.
Yeah, you gotta do that.
Absolutely. Absolutely.
and we are calling him the most famous physical therapist assistant.
In our opinion, of course.
of
That's
course.
right.
Of course. I appreciate that.
All right.
Yeah.
Did you want to say anything else about your work history, Jeff?
Maybe just a little bit. Other than
Sure.
being an instructor, I have worked in.
Well, Bob, we didn't tell him the title of the video yet.
Oh, yeah.
okay. How about I'll go into it in a little bit. Go ahead.
I want that job. Physical therapist, DPT or PTA will explain what those are, and present and long-term career opportunities. Sorry about that. I got off my
Yeah, that's right. So
habit.
DPT is Doctorate of Physical Therapy.
Right.
Which is now what is it, 6 or 7 year degree.
Yep.
And you get to be called a doctor, and you get a great education. It's a tough course. And PTA, physical therapist assistant,
5 semesters.
Yeah.
5 semesters, couple years.
right,
Couple years.
right, and you get to do a lot of the same work. There's some different responsibilities, but it's all in the same. You're in the same room.
Yeah.
Work with the same patients. So go ahead,
Okay.
introduce
Yeah,
yourself some more.
that was actually pretty good of describing what PTs and PTAs are. A little bit. So as I said, I've been an instructor for 24 years, but I also have worked in the clinic, and we're talking about really getting the physical therapy job, and what does that mean, and what settings might you work in, and what's your day like, and things
Sure.
like that. I'm going to start out by saying it's just a fantastic career as far as people always say I want to help people, and in this case, you really are. You are helping
Yes.
them move and learning to move again, helping with pain, getting back to work, getting them to go home after a car accident. A lot of different areas of physical therapy. I have worked in a rural hospital where part of my day, in the mornings, I see folks that were maybe injured in workers' compensation and
Yep.
trying to get them back to work, and did some work conditioning things, simulating the workplace. Later in the morning, some folks from the nursing home would come down. I get to work with history sitting right in front of you.
Yeah.
Cool
Yeah.
stuff. I miss that the most, as I don't do a lot of that care anymore.
Yeah.
And then in the afternoons, after school, all the local athletes would come in, and I had the pleasure of working with them.
Sure,
That's when I
sure.
worked in the rural hospital. Then I went to a rural nursing home as well.
Yep.
And again, as I mentioned, you have history right in front of you, and the stories, and you really get to know those folks, because you're working
Right.
in the nursing home is really their home at that point. So
Right,
that's really a neat
right.
thing. And then I do work in what they call a private practice now, which is a privately owned, and I go to outpatient therapy.
Yep.
So it's folks that come in off the street, and we see them for various injuries and all different ages and things too. So that's just a little touch of where you could possibly work, and we can get into that a little bit.
I always
later
feel
as
like
well.
physical therapy is a good lifestyle approach. I mean, for a job, it's good lifestyle for yourself, even, because generally you have set hours, and you if you work in a nursing home, sometimes maybe you'll work weekends,
Right,
but a
right.
lot of places don't even work weekends. Some you
Mhm.
do, some you don't. But it's just, wouldn't you say, Brad? I mean, if you're
Yeah, and there's a lot of opportunity for non-full-time work if you
right, if you want to go into part-time work.
right, if you want to work 20 hours a week or be flexible, which is really nice. And as you age, that may happen, or with
Right.
family demands or whatever. So yeah, and the diverseness of it is, like Jeff was saying, from workers, workers.
comp.
I was trying to think of the other work. Work
Right.
hardening.
Work hardening.
Work hardening, which is all related, but to skilled nursing home, to working in the public schools, working with children, pediatrics. It's just
Well, it says Jeff
across the
said though,
board.
you're always helping people.
Yep.
And I'll tell you, you feel good at the end of the day when
You
you're
do.
helping somebody all day
Right.
long.
There's a few challenges.
Yeah.
You may have usually with the patients, if they're in pain, there may be a little
Oh yeah, they're gonna be grumpy. to start
grumpy
over.
sometimes.
Yep.
You may have That's probably the most challenge I think I've had, is family members that would not know what's going
Right.
on in the clinic, and then you have to explain it to them, and that can be a little touchy.
Well, and families, they want what's best for their loved ones.
Right.
So, and you've got to explain. Sometimes it takes some time to get them here, or maybe this is as far as we can take them at this point too.
Right.
Those
Yeah.
so you might have some tough conversations,
Right.
but you may have a lot of reward that goes along with that too.
Yeah.
So
Sure.
they're really,
Yeah.
hey, another week here, and by gosh, mom can go home again or something like
Right.
that. And as I'm referring to, like maybe the acute care hospital or rehab setting or the nursing home, those kinds of talks. But I like what you said about it's the variety is really incredible,
Yeah.
and the ability to work like different jobs. You can work in outpatient clinic,
Yeah.
and then you could fill in nursing homes. Just work a couple of
Yeah.
part-time. We call them PRN jobs.
Sure,
Or, you
right.
may get a call every couple of weeks to come fill in.
Yeah.
So
Home health.
Home
same
health,
thing.
Yep.
and you can really make the job fit you
Yeah,
at
right,
times.
your life.
At times.
Yeah.
Depending on what kind of hours you want and things like that.
Why don't we go into, Brad, our next question? The general status of both PTA and PT right now. The job market, the
Mhm.
demand, the wages, and schooling.
Sure.
We got them all.
Got them. There's a
Yeah.
lot. There's a lot to that.
Yeah.
Just so you reference, if you haven't seen the date, we were just talking about this. We're just coming out of COVID. Things are looking better. So things in the last year have been unusual.
Right.
but-
Outlier.
Yeah, you can address that, Jeff.
Right. Of course, with COVID, our whole world has been turned upside down.
Right.
So the world of physical therapy, a lot of therapy providers, PTs, which are physical therapists, PTAs, which are physical therapist assistants, have been furloughed or their hours
Sure.
cut way back.
Mhm.
We're just starting to see coming out of the backside of that. People are taking
is.
temperatures at doors, are now seeing people again. And really, the therapy departments are opening up, and that's real important. We've had people that have delayed getting their knee replacement done
replacement,
and their rotator cuff repaired
Yeah.
because of all the restrictions in the hospital.
Yeah.
So that's opening up.
The-
So short term, it's getting busy.
Yeah.
What is it going to look like long term? And looking at some of the data out there projected for the year 2030, which will be here before you know it.
Sure. Right.
The years go by quick. There's going to be a few more employees out there, but than the demand currently. But they're saying that our population is going to change, so we're getting older.
Yes.
Mhm.
And as the older population, so some of those things, that's not necessarily nursing home work that's going to see all the employment, but maybe people that are going to be around longer, and you might be getting the knee replacements, so the orthopedic things in the hospitals, and then the outpatient setting. So the demand is going to be there still coming
Sure,
up in the future.
sure.
And as folks retire and move on in our profession, the average age is about 40. So it's a job that really has longevity to it,
Sure.
too, which
Yep.
is kind of a neat
Yeah,
thing.
I've been a therapist since '85, and there's almost been a shortage the entire time. I mean,
Yeah.
maybe with a few exceptions, there was maybe a brief year here or there,
Yeah.
but I mean, it's been really amazing that length of time to.
It is, and I
Right.
think it's part of the profession that we've branched out so much
Sure.
from kind of we kind of had our niche, and
Yeah.
now we've branched out into a lot of the community wellness kinds of projects.
Sure.
And we branched into
Work hardening, and
work hardening,
injury.
aquatic therapy. So we've expanded our
Yeah,
a lot of non-traditional therapies even that you'll see
sure.
some folks doing. So there's
Sure.
a lot of avenues out there, and that's why the demand has been there.
Well, again, as you say, age, as we know, I mean, something's cropping up every week on me now that needs help, and luckily right now that I've been able to handle it myself, but
Yeah.
at some point I may need another therapist, and
I
don't-
can't
I
relate
don't
at
know
all,
if it'll-
Bob. Can't
Yeah,
relate.
yeah.
So the demand is the schooling for it. And we talked in a previous video about schooling, but you're really if you're looking at down the road for the schooling, if you think I want to work as a PT, you've got to kind of get your ducks in a row now, because it'll be 7-8 years before you're actually out there doing it.
You
with the
got to
doctor
be
of physical
ambitious.
therapy.
You better be organized.
Right.
You better
right.
be a little bit smart, I would
Yeah.
say.
You got to be more than a little bit.
Yeah,
smart.
yeah.
That's right.
And financially, are you going to go into debt $200,000 to get that degree? And
Right.
so those things, can you spread it out? That's a whole nother topic. We don't have to
Right.
get into
It
too
is.
much, but it's something to consider.
Something to consider. You're going to have to spend a little bit to
Yeah.
make a little bit. The PT assistant degree is a couple years, but most programs have a wait list. So you're talking, if you decide today that I wanted to be a PT assistant, it'll probably be 3 to 4 years before you're really out there,
Sure.
in the job field.
Right.
In most places, some locations where it's still just the
Yeah.
5 semesters,
Sure.
you'll have quite a bit less debt there. But the intensity of the program, as you said, you got to be smart. You've got to be smart and want to work with people as well in
Yep.
the
Yeah.
PTA. And there's a lot of parallels to those hands-on skills you're learning.
Can we cover the wages briefly? What the averages?
Yeah. PTs nationwide are around 85,000 after you've been out a little bit, starting significantly less, mid 70s or
And
so.
depending
But
where
it's,
you're
but
at.
it's very
Yeah.
much location.
Yes.
On the coasts, of course, you're going to make more, but cost of living on the coast is quite a bit
Right,
more. In the
right.
Midwest here, our wages are significantly lower, but it doesn't cost as much to live here.
Yeah.
We're in Wisconsin. We make our own cheese, right?
That's
Yeah.
right.
Go to the store
And
for
beer
that.
too, I'm
And
sure.
beer. PT assistants, you're looking around 52,000 a year or so is
Sure.
about average. There are some higher end of that depending on what you're doing,
Sure.
and a little bit lower. And again, it's location as well.
Okay.
And the schooling can vary in cost if you're going to more of a private college for your doctorate of physical therapy
It'd be
versus a
very
state
expensive.
school.
Right.
You got to include
Right.
books if you're going to do room and board. So it's all things. Again, that's a whole separate topic about student debt and where does it all fit in.
Yeah, I think I don't remember where I read this, but as far as the PTA, it was a really pretty good return on investment. I mean, I was surprised
Yeah.
when I talked to some of our PTAs, which we've had many graduates from your program. Jeff and I have known each other for
Long time.
700 years. But
Yeah.
when they tell me what their debt was or what they paid, I was like, really? That's it?
Yeah, it's
I mean-
around 10,000 total for maybe 12 after books and all that.
And these
too.
guys were
Sure.
less at that time,
Right.
so it was, that was years ago, and I was amazed. So
I did kind of a little bit of a math equation here and looked at just general in our area cost of education for each versus your earning time too.
sure.
And this is just the Jeff Comey math here, but I did read a study that was pretty close to this. If I started as a PTA today, went to school, and Brad, you went for your DPT, and we started
Sure.
today on the same day, that I'd be done in 2-3 years.
Right.
You'd
Earning
be out
money.
there, and I'd be earning money at about year 20 or so. Okay, at about year 20 or so, it would be our break-even point. So if
Wow,
you're-
that's interesting.
Yeah. So if you're,
So because the PTA has been working for 4 to 5 years, earning money,
Making-
well,
Right.
the
Right.
And
doctorate
you had
is-
more debt as
and
a
then you got to pay the
PT.
debt. So it's about a 20-year trade.
That's a long time.
That's a really good way to
That is a
think
really
about
good look
things.
at it because
because you're going to be out doing similar work. The PT has a lot more responsibility, of
Right.
course,
yeah,
as a decision maker. But so you got to know what your personality
Right.
is, and
Exactly.
I mean, you do,
And if you go back as a second career and it's late in life and you're going back to
Yeah.
a second
Yeah.
then
career, you're probably best off thinking PTA route
Right.
because
Mhm.
to
and
recoup
you've seen that.
I have seen that.
It was unusual when I was going to PT school to have someone that was older than 27 or 26. I mean, it
Mhm.
was.
Right.
I remember one guy came back at 30 or 29, and
That was old.
he was the old
was
guy
old,
in the
yeah.
class. I mean,
I think the
So-
average age of the student in the tech schools where most of the PTA degrees are in junior colleges is 26. But I've had students as old as 50 in the class.
yeah, that's amazing.
And,
And I've never
sure.
seen a PT that old. But Brad, you went
Yeah.
back late.
Yeah. Well, when I was in PT school, I was 33, but we did have a woman. She was 52
Oh my
when she was in
gosh.
a PT class. I mean, she
made it.
oh yeah, she did very well. Yeah. So she's
Incredible.
probably retired by now, I'm sure.
Yeah, yeah.
Yeah, but I wanted to look at this point about the doctorate program. Is a doctorate program, is that the same as a PhD?
No,
Or is-
they're different. Okay,
Okay.
and you're not a medical doctor, but they're doctorate credits in physical therapy. So you're
Okay.
a doctor of physical therapy. You can call yourself Dr. Heineck.
Sure.
If you know.
That's correct.
That's yeah.
Yep.
But honestly, your patients, they'll call you by your first name typically
Sure.
because that's how we address our patients. They
Yeah.
won't often call you doctor,
Yeah.
but your colleagues certainly might, and that's the degree that you get. The interesting thing about our profession is that there are PTs out there that are bachelor science
Yep.
PTs.
Right.
There are some that are masters,
Yep.
and they're a doctorate of physical therapy, and the training has changed with each of those and become more intense and more detailed, and maybe and dovetailed off into some different directions with more diagnostically things with the doctorate as well. The advantage that the folks that are starting out or that have been around for a little bit is they've been around for a little bit, so they've got the experience too.
Right.
So really, the playing field's fairly even, other than the doctors are coming in with these some of the newer skills, and especially like reading X-rays, things like that. So that's the unusual part about as a PT assistant working in that world with folks with 3 different degrees, but they're all called physical therapists. And that's something to keep in mind.
And I think in the whole profession itself, I mean, you have to be constantly learning. I mean, your learning doesn't stop the day you walk out of school. I mean,
it kind of starts then.
Yeah.
Because you get that real hands-on.
Yeah.
I mean,
and there's requirements for continuing education, but beyond that, you should be trying to improve yourself all the time.
So I wanted to ask further about the doctor part. What's going to happen, and this has been big talk in the therapy world, is there going to be direct access, and is it going to be like in the United States anyways, where you don't have to see the doctor to get a referral, and then you'll go right to the therapist, right from the sprained ankle, you go right to the therapist?
Sure. That's been the initiative for a lot of years.
And
one of the reasons historically to go to the doctorate of physical therapy was to say, okay, we need to kind of up our game a little bit in physical therapy here, so we have the clout, so to speak. So that was and I pounded the table to say clout, but that was one of the reasons for going for the DPT.
Sure, exactly.
One of the many reasons, but was to have this direct access where you could walk in off the street, similar as you do with like a chiropractor.
Right.
Like that. It's happened some, but there's been a lot of roadblocks. Our healthcare system is very physician driven.
Yes.
So there's been some pushback from there, and some, hey, it's a great idea from there too.
They have a strong lobby.
Exactly.
Because a little political at that point.
Insurance companies that are paying for the care, they're a big roadblock as well. So there's been some progress there. It's been our national organization, the American Physical Therapy Association, has gone to bat for PTs in our profession many times over, and they're still fighting to see, direct access. I think that if that came to fruition, where there weren't any limits, that the access for patients was what we really want. Will just be a big boon in our profession.
Right.
And really, that's why we want it. We don't want to say, oh, look, so we could. We're a doctor. Come on in and see us. We want it because we want access for
Make
patients.
it easier for people. I mean,
that's right.
now.
It's going to reduce the cost of healthcare, which is a really strong point. Which it just seems like to all of us, it seems like such a easy thing. It doesn't make it's a no-brainer kind of a thing.
It is a no-brainer. It also gives the patients choices.
Right.
Versus you're only going here if it's direct access, and you have a clinic, and you have a clinic, and I have a clinic. The patient can choose which one they want to go to. Maybe you're better at this specialty than I am, and it gives them a little more flexibility that way. So that's the direct access conundrum, so to speak. It's there, but it's not used 100% yet.
And you're seeing some states that seem to have more than others, and regional areas that seem to have more access than others. So it's moving slowly there, I think, and I'd be surprised if it didn't get there, but it could take a while.
It's going to take some time yet. Right. We've been fighting that battle for a while.
Wow. So overall, we all concur that it's a wonderful field if you're a people person, and I like that what you had said last time about how you knew physical therapy was the job for you.
Yeah, tell the story.
Well, I knew when I was on my internship, because all of your schooling, you end up going on an internship, seeing patients. That's what it's all about, really. The classroom's great, but you'll learn so much more from the school of hard knocks, so to speak, when you're out there. And I went to say goodbye to one of the patients that discharged from the nursing home where I had interned at, and she waved me over, and I could still see her face. And so I bent down to hear her talk to me, and she waved me closer, and I got a kiss on the cheek. And that meant everything to me. That
it is.
Made that connection. And she was so thankful that I got a kiss on the cheek. And that's when the light bulb went on bright for me, that this was the profession for me. And I haven't looked back. And in my job I have now, where I teach physical
Yeah.
therapy providers, I like to think a little nugget of me goes with each one.
Yep.
And I get that
Absolutely.
I get that little bit,
Yep.
and I think it's so important. It's a great profession. If you really want to help people,
Yeah.
this is in a lot of different ways you can do it. This is the field,
Right.
a great field. Really think about it.
Right.
Well, thanks again for Jeff coming to our show. I'm sure he was scared to see us and deal with us. Who isn't?
Yeah.
Who wouldn't be?
Yeah.
Did I look that nervous?
Yeah, no, he's natural on camera, that's for
Yeah,
sure. So
absolutely.
he's probably going to take over our show. So, all right. Thanks everybody for watching.
Take care.